Welcome, everyone. We are really glad that you are able to join us today for this informational session on glyphosate. I'm Lisa Peterson. I'm a professor at the University of Minnesota, and I study the causes of cancer. I'm also one of the lead investigators for the 10,000 Family Studies. The National Cancer Institute has awarded the 10,000 families a grant funding to collect information on specific environmental exposures in Minnesota. One of the chemicals we plan to study is glyphosate, the active ingredient in RoundUp and other products. The goals of this webinar are to provide you with information on the safety concerns regarding glyphosate and how to use this pesticide safely. In addition, we want to let you know about the 10,000 Family Study and how you can get involved. To achieve the goals of the webinar, we've invited 3 experts on the health effects of and safe use of glyphosate-containing products. Dr. Stephen Kirkhorn is the Medical Director of AgriSafe Network and Senior Occupational Medicine Advisor to the NIOSH Upper Midwest Agriculture Safety and Health Center, that's the UMash Center, based in the School of Public Health at the University of Minnesota. He will describe the short-term effects of glyphosate. Ms. Megan Soucho is the Outreach Director and Center Coordinator for UMash and will tell you about how to work with glyphosate-containing pesticides safely. Dr. Christine Klotz is a scientist at the the Minnesota Department of Health's Health Risk Assessment Unit. She will summarize what is known about the long-term health effects of glyphosate exposure. Before we start, I'd like to provide you with an overview of the 10,000 Family Studies. This study was launched in 2017 by a group of researchers from the University of Minnesota School of Public Health and Medical School with seed funding from the university's Masonic Cancer Center. The goal of the study is to investigate the impact of the environment, genetics, and lifestyle on the health of Minnesota families and the development of illness over time. We are committed to including families from all communities across the state, urban, suburban, and rural, where there's a wider variation in what we are exposed to. We received a grant as part of the National Cancer Institute's and the National Institute for Environmental Health and Sciences cohorts for environmental exposures and cancer risk, which is SEEKR program, to study exposure of Minnesotans to radon, perfluorinated chemicals, or PFAS, and glyphosate-containing pesticides, to see if these exposures are associated with an increased risk of blood cancer. Minnesota has increased risk of blood cancers relative to the other states, and these the exposures that we selected are elevated in Minnesota relative to other states and have been linked to increased risk in increased cancer risk in other studies. To help us to recruit Minnesotans and their families to the studies, we have a close and long-running partnership with the Extension Department of Family Health and Well-Being due to its extensive relationship in Minnesota communities and the ability to advise and connect us to staff and communities for recruitment and education purposes. We are happy to have this opportunity to provide information about the safety and safe use of glyphosate. Following the presentations, we will have a question and answer session. I would like to call your attention to the Q&A tab at the bottom of the screen. You are welcome to enter your questions in the Q&A tab at any point during the talk, and we will answer the questions at the end of the presentations. So with that, I will now introduce the first speaker. As I mentioned, Dr. Stephen Kirkhorn is the Medical Director of AgriSafe Network and Senior Occupational Medicine Advisor to the NIOSH UMash Center based in the School of Public Health at the University of Minnesota. He is an occupational health physician who has completed all of his education at the University of Minnesota. He has a BS in zoology, an MD, and a master's in public health and environmental health. His long resume indicates he has extensive medical practice and training experience in rural and agricultural health. Dr. Kirkhorn will provide an overview of the health effects of the acute health effects of glyphosate-based herbicides. Dr. Kirkhorn, you should have control of the slides.
Good morning. Thank you very much, Lisa. I'm pleased to be here this morning. I consider myself an occupational and environmental medicine specialist. I've done both acute care and consulting work with in rural areas. I'm just going to start my timer here so I don't go over. I was with the Mayo Health System out of Mankato, working with pork producers, a medical director of the National Farm Medicine Center, and occupational medicine Marshfield Clinic in Wisconsin, dealing with dairy producers. And so I've seen both acute injuries, but also referrals because of environmental exposures. I actually have the easy part of this assignment today in overview of the acute health effects of glyphosate-based herbicides. So I'm going to go over some of the acute toxicity. And one of the things to be aware of, and Megan may be talking about this later too, just what some of the signal words are. Can you go back one for me? There we go. The glyphosate-based herbicides, and RoundUp being an example, are some of the most widely used herbicides around. It's a glyphosate isopropylamine salt. And there are signal words for all the pesticides, and glyphosate is a herbicide. So the signal words are describe the acute or short-term toxicity of formulated pesticide products. So there are three danger words. There's danger, warning, and caution. Danger is the most toxic, and caution is lower in toxicity. And most of the glyphosate-based herbicides have the caution signal word, though some may be moderate because of eye damage. So generally, it has the acute toxicity will affect the eye, skin, and ingestion. So I can have it can be a moderate eye irritant of the undiluted product, and it can cause pain, redness, and that should be tearing. The skin may be slightly irritating to the skin, and it's no more than slightly toxic with no significant adverse health effects that are suspected to develop if a small amount, which is less than a mouthful, is swallowed. We'll talk about more massive exposures. But it may react with metals such as galvanized or mild steel to produce gas, potentially forming highly combustible and irritating gas mixture. Sometimes this goes forward when I click, other times not. There we go. Guess there's a delay. So the usual occupational unintentional exposure effects include mouth and throat pain, nausea, vomiting, and diarrhea, and abdominal discomfort. Now the toxicology is interesting. The mechanism of action is considered to be a plant-specific inhibiting enzyme responsible for synthesizing phenylalanine, tyrosine, and triphosphate. And this enzyme system is not considered to be present in humans. And that's been one of the selling points probably for the herbicide, in that it's generally considered to be much less lethal. Tomorrow I'm giving another webinar on organophosphates, which is completely different as far as acute short-term effects. But there is a high lethal dose 50 in the range of 4,300 milligrams per kilograms. And the lethal dose 50 is a concentration that kills 50% of the rodents that it's administered to. And in contrast, in comparison to paraquat, which is a very toxic herbicide, which has a LD50 of 80. So there's a significant difference for acute short-term toxicity. So when you look at an example, RoundUp Pro concentrate herbicide and the safety data sheet. So what has to be on that is a classification in accordance with the regulation 1910-1200, which is the Occupational Safety, Health, and Administration Hazard Communication Standard. So that under the hazards identification, it's not considered hazardous under the criteria of the federal OSHA hazard communication, no physical hazards otherwise classified, and no health hazards otherwise classified. So this is the official designation. Next, please. There. So the acute health effects, the GI symptoms are most common, and is usually self-limiting from unintentional exposure, but there are more severe effects if intentional oral ingestion occurs, such as suicide attempts. And there have been suicides using glyphosate. Now, the other concern is if it's not properly stored and it's in an unmarked container and a child drinking it, or even somebody else thinking it was a soft drink or something else. So having this having any pesticide contained in its proper container with labeling is critical. So it can cause cardiovascular and respiratory and renal symptoms, such as tachypnea, which is rapid respiration, cardiac arrhythmias, hypotension and shock, and oliguria, which is a severe decrease in urine production leading to renal failure. And death can occur in from severe hypotension and respiratory failure. Next, please. So from the usual occupational exposure, you decontaminate with soap and water, treat eye contamination with irrigation of clean water for at least 15 minutes, and remove contact lenses before irrigation. And for one point I want to make is that it's always worthwhile to call the Poison Control Center. You know, I'd like you to write this number down if you don't know it. It's 1-800-222-1222, and we'll put those in the notes. And that's really based upon your area code when you call. You'll be automatically sent to the nearest poison control center to you. And one of the issues is that for physicians, and I know from teaching in medical schools and residencies, there is very little to no training in occupational medicine or toxicology in most medical training. So generally, if you're going to go to a rural family practitioner, more than likely they have not had that training, and certainly in an urban setting, it's going to be similar. So having the number of the Poison Control Center for an exposure is really critical. So generally for treatment, for the usual exposures, it's decontaminating with soap and water, treating eye contamination with irrigation of clean water for at least 15 minutes, and removing contact lenses before irrigation. Forward, please. However, in severe exposures, next slide. Yes, all the issues of trouble support will be taken care of with me on my presentation. So for severe treatment, providing supportive care, correct acid-base disturbances, control acid doses, controlling electrolyte disturbances, providing oxygenation, treating cardiac arrhythmias, and preventing renal failures. However, this is going to be primarily from massive ingestion and not from the usual occupational exposures.
So our next speaker is Ms. Megan Sasho, who is the Outreach Director and Center Coordinator for UMass, where she has worked extensively in outreach and community engagement in emerging issues since 2017. Her background areas of expertise include agronomy and policy analysis, and she holds a BS and MS from the University of Minnesota. She implements the Health and Safety Outreach Program for UMass, which prioritizes research to practice in the One Health model. She has previously worked as an agronomist in government relations and state government, and with her family who farms in Southeast Minnesota. She will describe on how to safely handle glyphosate-containing pesticides. The floor is yours.
Thank you so much, Dr. Peterson and Dr. Kirkhorn, for your opening part. I would argue with Steve that I have the easy part today. And so we'll talk today about the safe handling of glyphosate if you are handling it, or if for some reason you are at higher exposure levels than a regular person might be. So we will get into it. So I'm not going to talk a lot about acute exposures. I do have one slide that I am going to mention. But Steve, I think, did a nice job explaining what those look like and symptoms. And oftentimes they are incredibly rare. There are also, of course, things that are chronic exposures. So some level, some dose, some amount of thing over time. And we'll hear a little bit more about that from our final speaker today. But a big part of safe handling is really reducing what that exposure is over time. And there are several ways to go about doing this. If you could go back, thank you so much. So whenever I do these kinds of talks, I do like to say something about safety and risk. And so forgive the kind of on the nose wording there, but oftentimes when I'm thinking about this kind of work, the words hazard and risk are really kind of thrown around. And I like to sometimes pause and talk about what those means, because it does matter for when we think about risk in particular. So hazard is always what I think of as the agent of harm, the thing that can be dangerous or is dangerous. So, and this situation, we're talking about the product glyphosate. And then when we think about risk, we're really thinking about how much are you exposed to? How likely are you to be exposed to the thing? Oftentimes said more simply for the Midwesterners of the world, hurricanes are a potential hazard with, great potential for harm, but not in Minnesota. So the risk is actually fairly low, even though it's a dangerous thing. So that's something I always like to say about hazards. And then the other part of risk is there's oftentimes a very nuanced view of risk, in that each individual has, different risks in the world. Some of them, being even genetic. And there are also, your own values play into your risk. And so that varies for each individual. But when it comes to glyphosate safety, the gold standard, and anyone that's worked in like agronomy or lawns or horticulture, it's actually kind of a joke. It's always just you check the label. The problem with the label is they're not incredibly user-friendly. So we're just going to take a look at those today and talk about how we can handle these products safely and some hot tips, if you will. So the QR code on this page goes to said label. So the 60-page label for a particular product, which is 41% glyphosate, which is something you would oftentimes see in lawn products. Next slide. So I'm not going to spend a ton of time here because Dr. Kirkhorn did a really nice job talking about acute exposures, particularly those large dose exposures. But we see that particularly in acute large exposures, there can certainly be some pretty serious effects from glyphosate. I'll talk a little bit more about reducing the exposures of, regular handling or exposure that a human may have going throughout their life. Next slide. So as I said earlier, the gold standard is oftentimes just read the label, check the label. What does the label say? And so the label is both your friend and also sometimes the enemy, just because of how they can appear. And so both of these containers or labels are something that you're very likely to run into if you're handling glyphosate, in a lawn, in your work, whatever it may be. And so here we can see one thing to always be looking for are the active ingredients. So today we're talking about glyphosate. This product in particular, the only active ingredient is glyphosate. You're not always going to see that. There are oftentimes mixtures, which I'll talk a little bit more about later. The other thing you will oftentimes see, right up front are things like the caution statements. So those are going to tell you what to do if it is unintentionally or accidentally consumed. If you get it on your skin, for some, dermal toxicity is much lower than others. Glyphosate is one where dermal toxicity is fairly low, but you're still not going to want to have it on your skin, and it'll explain what to do in those situations. You'll oftentimes be able to find the hotline number in these areas. Great thing to just have in your phone though, because small print, it's all the same color. It all looks exactly the same, even when you're not, pressed for time or stressed. And so having that saved in your phone is always something I like to tell folks. Next slide. Here is a reason why I say the label can be the enemy. I don't know that anyone can read anything on this entire slide, and that's kind of the point. But what I have starred are the areas on the page which cover the personal protective equipment, PPE, as well as user safety directions. Again, this is all for that same product, glyphosate, 41%, very common in lawns, gardening. I found it on Amazon, Walmart. I could get it shipped to my house in like an hour. So this stuff is very accessible. As we've heard, it's an incredibly ubiquitous product. And so a little what the label actually looks like. So under personal protective equipment, we can see typically for a glyphosate-based product, just glyphosate, frankly, we are looking at things like having your skin cover, long pants, long sleeves, having closed-toed shoes on, Sometimes I talk about, if people ever went to a lab in high school or college or whatever it may be, you always you covered yourself up. While not required, things like goggles or glasses to keep it out of your eyes, and then respiratory protection. If you're using these products for work, there are standards in place for which products you do have to use respiratory protection with. The worker protection standard may be what people have heard of. But oftentimes, if you're doing this on your own, you're not required to. With this product, it would be something that I would say do as you're comfortable, and particularly if it's important to you. If you're, say hand applicating, and there's a potential for inhaling some of those droplets, a respirator is going to be a great idea. I'll throw a link into the chat once I'm done talking that it has a really great guide on respirators. So some products that are like physical pebbles, for example, a lot of times those are pre-treatment pesticides, will ask that you wear a respirator of sorts. Sometimes it'll say dust mask. That is literally just a dust mask. So the things that we wore a lot during the COVID-19 pandemic, for example. And then depending on there, we can kind of ratchet things up to things like an N95, which folks are incredibly familiar with and are incredibly effective, even with pesticides, and then going up from there. Next slide. And so this is this is a re-emphasis of the safest way to handle. So wearing protective clothing and eyewear, avoid standing in the spray, the droplets, the area of application. Don't get it on skin and eyes, wash it off then immediately. Steve mentioned this as well, but contacts really love to suck things up. And so if you get it in contacts, taking those out immediately. Some other things that I like to say are, as soon as you're done with an application, changing the clothes, washing up before doing anything like eating, drinking, if you're a smoker, things like that. And I sometimes like to think of pesticides as like, a paint of sorts. It's like you don't want to be dragging them all through the house or whatever it may be. So kind of thinking about how you're handling some of that stuff separately. Again, that becomes increasingly important as we handle things like insecticides and different kinds of pesticides, but is important no less in this situation. Next slide. A couple of notes about safe glyphosate handling that I like to point out when I'm talking with folks, especially just out the real world, are that oftentimes the products that we see and use and that are available for sale at your local Lowe's, your local hardware store, are oftentimes, not always, but it's not uncommon to see things that are mixes. So products that I know that are really common in everyday households are things like Preen, RoundUp spray bottles. Those are oftentimes mixes of sorts, and so they can be other pesticides or even things like surfactants that help the products stick to a plant better, for example. And so I say that to remember to be looking at those active ingredients. And if you're reading the label, the instructions are always going to reflect the level of potential harm of the product. So say you're looking at Preen, which has additional products that are very different to glyphosate, the personal protective recommendations are going to reflect that. But I do like to tell people to keep an eye out for those, because if you're looking exclusively for, the product RoundUp, for example, there will sometimes be other products in there to be mindful of. And then I also think it's important to say that everything I've talked about today is for the product glyphosate in particular. And so when you start throwing other products in there, those recommendations really might change. Things that we see in lawns a lot are products called dicamba and 2,4-D. Banvel is one of the brand names, but these are really known for lawns because they kill a broadleaf leaf. So the kind of things you don't want in your lawn. And those are going to have different recommendations. So that's part of why we always say, look at the label, because those are always going to reflect with all of the studies that have been done on all of these products and how they may or may not affect a human. And then my next slide is my last slide, which is colorful and sometimes a bit academic, the hierarchy of controls. And so really all this is a spectrum of what we can do to reduce our exposure and increase our safety with any kind of hazardous agent or risky task. So the gold standard is always going to be you eliminate the thing, which oftentimes easier said than done. You know, we live in the age of automation, so there are times where we certainly can't eliminate risky tasks. In the case of glyphosate, that might mean that you're thinking about different versions of pest control. The University of Minnesota Extension has an incredible integrated pest control team. So if that's something you're interested in, I would encourage reaching out to them as resources. Substitution is another one of the gold standards. So you have some dangerous thing and you replace it with something that's less dangerous. When it comes to glyphosate, again, on the relative spectrum of risk and hazard, pretty safe. You know, maybe if it's really important to you, you're looking at elimination or adding in some of these other controls. So engineering controls, some engineering solution that helps so that you don't have to do the thing. Drones, I guess, can apply pesticides. I think that practically most, you know, lawn owners are maybe not doing that, but there are certainly engineering controls out there. And then we have administrative controls and PPE. Again, like very much what they sound like. So when it comes to pesticides, the time of day can matter as far as how exposed a person may be and how effective the product may be. You can limit entry to the area. We oftentimes see these little signs that say pesticide recently sprayed, keep kids and pets off, and generally speaking, listen to those. Also things like hygiene. So the washing of the clothes, washing of the hands before moving on to activities, and thinking about keeping that occupation, so that thing you're doing with glyphosate separate from whatever else you may be doing. And then lastly, PPE, which we talked a little bit about, having that clothing, eye protection, some kind of respirator can certainly improve your comfort, especially if you're close to it while you're applying it, though it's not required. And then I think I saw a question in the chat even about goggles. It's a good idea. You know, it's not something that you want to get in your eye. It's not a product that splashes incredibly, but it is a good idea. And that's another one where if you're close to the product when you're applying it. So again, if you have, for example, sometimes people will have little handheld applicators that will, you know, you're closer to it. And with that, we will pass it off to the next speaker. And I thank you for your time and attention.
Thank you very much. Our next speaker is Dr. Chris Kloss, who is the Health Risk Assessment Supervisor at the Minnesota Department of Health. She's a toxicologist who received her undergraduate degree in biology at the University of Minnesota and her PhD in biomedical sciences at the University of Texas MD Anderson Cancer Center in Houston. She did a postdoc studies at the University of Wisconsin-Madison that focused on DNA damage response in stem cells before returning back to Minnesota, where she is a scientist at the Minnesota Department of Health's Health Risk Assessment Unit. They analyze animal and human studies to determine how much of a contaminant in groundwater is still safe to drink. One of the chemicals they consider is glyphosate. Dr. Kloss will discuss the long-term health effect risks associated with glyphosate exposure.
Thank you, Lisa. I want to thank Lisa and the Minnesota 10,000 study for inviting me here. I work at the Department of Health and we make guidance for groundwater. So I bet a lot of you didn't know that we have a unit that does that. So what we do is we work in partnership with the Pollution Control Agency and the Minnesota Department of Agriculture. And they request guidance values based on health for different contaminants that they find in water. So That's what we do. You can see here on the slide that we looked at glyphosate a few years ago, and basically the short-term and subchronic health-based values are 1,000 micrograms per liter. That means that glyphosate can be in your water up to that level and will cause little to no health effects for you. So it's safe to drink. The chronic value is 500 micrograms per liter. So it's a little bit less, but again, these are health-based. So that means that you can find glyphosate in your water up until that point, and it will cause little to no health effects. Next slide, please. So are we exposed to glyphosate? You bet we are. So here is a map of the United States, and you can see Minnesota. We have the southern half of the state that is heavily exposed to glyphosate. So that's that dark brown color. So this is glyphosate used in agriculture. You can see below us, Iowa and Illinois, they're covered in glyphosate. Next slide. So Megan talked a little bit about the exposure routes. So you can look on the far left of the screen. So these are different routes of exposure, different ways we're exposed to glyphosate. Farmers, landscapers, gardeners, we're all exposed via inhalation. So when you spray it in your garden, or farmers spray it on the crops, it's aerosolized, you can breathe it in. Also dermally, you can leak from the bottle, it touches your skin. So that's a common way that we're exposed. All of us are exposed via the food we eat. So there was a study done a few years back where they looked at how much glyphosate is in common foods and found that the oat-based cereal and breakfast products we eat have the highest amounts of glyphosate in. So our beloved Cheerios has between 600 to 1,200 parts per billion, or micrograms per liter, we use those interchangeably, of glyphosate in them. Other trace amounts were found in Oreo cookies, in orange juice, and in ice cream. So even those people who don't live in Minnesota are also exposed to glyphosate, and that's because it's in our food. The other way we're exposed is via our water. So glyphosate's applied on crops and fields, it sinks down through the soil and then gets into the water we drink. So we've detected glyphosate in public drinking water systems between 1 and 39 micrograms per liter. And then in surface water, so that's like your rivers, that's around 43 micrograms per liter. And if you notice, all of these are well below the 500 micrograms per liter that we based on health. And so far, we have not detected any glyphosate in our groundwater in Minnesota. So we're doing pretty good. Next slide. So what do we do when we look at glyphosate? We look at studies, animal studies, human studies. And for chronic exposure, one of the things that we noticed in study after study after study is that the salivary gland was changing in animals that were exposed to glyphosate. So salivary glands are in your mouth. They help produce saliva. They were changing at the cellular level. And this was one of the chronic exposures. So chronic is basically, for a human, about 7 years up through your lifetime of being exposed. For the animal studies, it's about a 2-year exposure. So that's one of the effects that came up repeatedly in the animal studies. What about people? So people, there is no consistent evidence of effects for people being exposed. There's been different studies, and you can see here I listed some of them that have been completed. So they've looked at heart. Hey, Addie, shh, I'm giving the top. Sorry, I have a 7-year-old who's on summer break, and she's forgetting that I'm on camera. So you can see there a host of different health effects have been looked at in response to glyphosate exposure. And so far, nothing has risen to the top. There hasn't been any positive correlations that have been repeated. Okay, next slide, please. So where does all this controversy come in? So I talked about the non-cancer effects. So in animals, it's a salivary gland. In people, nothing seems to be correlated. Well, it all started with the International Association for Research on Cancer saying that glyphosate caused cancer. And if you remember, late at night, you'd see the commercials pop up. Did you get non-Hodgkin's lymphoma or a blood disorder from using RoundUp? So this is what resulted from that announcement. Next slide. So one of the controversies that arose is when IARC a couple of years ago said that glyphosate probably was carcinogenic to humans. And then you had, on the other hand, the US EPA and the Food and Drug Administration, Health Canada, and other regulatory agencies saying, no, glyphosate's not likely to be carcinogenic to humans. So you've seen this back and forth in the news. There's one major difference between these groups, and that is where the controversy lies. So IARC is saying, can glyphosate cause cancer? So that means in all these animal studies, if you throw the maximum tolerated doses and super high doses at animals, will they get cancer? And regulators like the EPA, Health Canada are saying, if you expose these animals and humans to glyphosate at the dose that humans get, will it cause cancer? So they're looking at very different things, right? Can it cause cancer, or will it at the doses apply that humans are exposed to? So that's one of the main issues here. Okay, next slide, please. So when we look at cancer studies in animals, there were 13 studies that IARC looked at. And so then we looked at them too, because we had to know, do we have to make a cancer number, a cancer health number for glyphosate in water? Well, there were 13 studies, and you can see here, I'm not going to go into them deeply, but there's kidney cancer, blood cancers, pancreatic cancer that occurred in rats and mice. We looked at these and there were no dose responses, or there were very big limitations to these studies. So there was no significant trends. Some of these cancers were benign. Some were only at that maximum tolerated dose that was applied to animals. Next slide. So then we looked at the lymphoma. Yep, next slide. Lymphoma. So there were 4 mouse studies that looked at lymphoma. Lymphoma is a common tumor in mice as they age. So this muddied the data, right? Because as a mouse ages and they automatically get lymphoma, it's like, did the glyphosate cause it, or did aging cause it? So there were 2 studies that had no statistical significance. So that means everything was within, chance of the mice getting lymphoma. And then the other 2 studies that had statistical significance at the top dose, the highest dose tested, the mice had a viral infection in one study, and this virus causes lymphoma. And then the other one, it was still within the historical control range. So mice receiving the control just developed it naturally. So there was no concrete evidence in our study, in our minds, that glyphosate caused cancer. Next slide. So that's what our summary was. The scientific consensus hasn't been established. We couldn't find a positive trend that concretely said that, yes, glyphosate caused cancer. So we decided not to develop a cancer number. So all of our numbers are non-cancer for glyphosate. And we decided that this 500 micrograms per liter that was based on the salivary gland in mice, changes for that was protective for any cancer that might develop. Next slide. But what about people? So there is a fabulous study that is ongoing. It's called the Agricultural Health Study. It's huge. It was started in 1993 and it has almost 60,000 participants. So it's people who apply pesticides. It's farmers, it's landscapers, and they're people and their spouses from Iowa and North Carolina. And the goal was to identify causes for blood cancers in farmers. So farmers generally have a little bit higher incidence of blood cancers. So that's why this study was started. There are different enrollment periods. The study The study follows them over time. So you can see up here, they gave DNA samples, they talk about their diet, they update their medical history. Next slide, please. And then studies were done on this big study. So the first one was in 2004. They looked at glyphosate in any type of cancer and did not find a link. There was a suggestion of an association with multiple myeloma, but you notice that disappeared in 2017 because 2017 was a follow-up one. And again, there was no association between glyphosate and any cancers in this study. Next slide, please. A study came out in 2019 that caused a stir. They used the agricultural health study and then pulled in other case control studies. So these are studies that had fewer people in them. And they were able to find an increased risk of non-Hodgkin's lymphoma. So you can see there it's 1.4, so it's over 1. But there's big limitations for this because there's more case control studies. And why did only these 5, combining them with the big study, increase the risk, but not say another 5 or a different mixture of studies? So you know, that's something that has to be looked at more. So for this instance, I would say there's no concrete evidence yet. Next slide. So this is my summary. So what are the long-term effects? What do we know? What do we not know? In animals, we know that non-cancer effects of glyphosate long-term cause changes to the salivary gland. I don't know if they get dry mouth, if mice and rats get dry mouth, but it caused changes at the cellular level. Number 2, in animals, did it cause cancer? Depends on who you ask. If you ask IARC, did it cause cancer? Tumors developed. But if you look at the exposure that humans are exposed to, there was nothing there, right? People, non-cancer, is there any effects? There's no consistent evidence right now. People are still publishing studies, but right now there's nothing that has risen to the top. Number 4, what about people and cancer? The jury's still out. So we have the agricultural study that's still ongoing. People are aging. Will it show something? As of right now, it has not. But we'll see as people age because cancer takes decades in some cases to develop. Next slide. So what do we do at the Department of Health? So we have our 500 micrograms per liter in water that's safe to drink. We reevaluate approximately every 5 years. So we keep a lookout for new data, new studies, new information, and then we will look at it again in every 5 years and see if anything would change our values. If you have questions, you can please feel free to email me at my email address right there. And I thank you all for your time today.
Thank you very much. What the role the 10,000 family study wants to take is to help resolve some of the unanswered questions. And so we want to explore the possibility that glyphosate use is associated with an increased risk of blood cancer in Minnesota. And you can help by joining our study. We invite anyone tuned in today or viewing this webinar afterwards to fill out the 10,000 families eligibility survey and to share it with others in your community. The survey takes just 5 minutes and can be filled out by any adult age 18 or older living in Minnesota. Then you can invite adult family members of any age and enroll children who live in Minnesota or a neighboring state. It only takes 2 people from a family to join the study, but the more the merrier. This slide has the link to our website, which tells you how to join. We hope that you will participate in this journey to learn more about family health in Minnesota and how environment, genetics, and lifestyle affects our health over time. With that, we will now address questions entered in that question answer tab. And I'm going to stop sharing my screen so that we can see everybody. And I'm going to ask the panelists to open and we'll answer the questions in the question answer tab. So enter your questions there. So the first question is, how are we to have trust in science when these larger entities, OSHA, deem these products safe? I find it scary that new studies show connections between these safe products and cancer. And so, Chris, perhaps given what you just said, you could answer this question.
Right. So I often wondered that too, actually. So you would think that products on the shelf are safe if they're out there for purchase and you can buy them. But one of the problems is that when a product comes out to the public, they're not tested for everything, right? So yeah, when we look back and like look at let's look at the PFAS chemicals. So why were those even allowed to be put in products? Now we know like all of the effects that they're having. I don't know, did people test for them at the time, or maybe they didn't know to test for certain issues at that time? So I think the best thing, I like working for the Department of Health because the numbers that we come up with are purely health-based, right? So some EPA numbers also rely on cost. What is the cost for cleaning up PFAS or glyphosate in water? And so sometimes the limits are put on there. I guess the thing to do is to always just know where the data is coming from and to know, to look at who is behind the data, you know. So yeah, but I know it's not like a good answer for you. And as a parent, I too, I wonder why some products are on the shelf when they haven't been thoroughly tested. So yeah, I don't have a good answer for that. I wonder if Stephen does or Megan, but yeah, I don't know. I personally don't know why some products are out there and why we can trust some agencies, you know, when they all have their own rules. So yeah, I know it's not a good answer for you. I'd like to hear from Stephen or Megan and throw that one at you.
Sure. Well, you know, I think to be honest about it, some of it's a cost benefit ratio, looking at food production, looking at some of the production of other things. And unfortunately, there's never enough money to do the type of studies that really can help answer that. And sometimes it is multiple studies. You know, I've been involved over the years where somebody comes in with cancer and wondering if it's from exposure to a certain issue, whether it's occupational or environmental. And also done that in the VA system for looking at such as Agent Orange, and there was an exposure in Vietnam or elsewhere causing their cancer. So it really goes back to looking at, is it greater than a 50 plus 1% that it caused that? And, you know, some of the number of these studies come in less than that 50 plus 1%, but that's the reality of how a decision is made, whether it's environmentally related or occupationally related to an exposure to a certain compound. And what I've done in evaluations, I had to do a literature search and to see how many studies are of adequate quality that would support an exposure to such a compound, whether it's glyphosate or other compounds. And with glyphosate, you know, one of the issues is that there is a mixture. It's not pure glyphosate, it's glyphosate-based herbicides in many cases. And so you're talking about different compounds also. But it really comes down to adequate funding and getting the studies funded to be able to do more in-depth and large enough studies, because studies do contradict each other, unfortunately.
Correct. And yes, not all chemicals are so extensively tested as well. So I'm going to move on to another question. So Steve, I think you might be the best person to answer this one. What is the risk of injury due to unintentional glyphosate exposure?
Well, there are, you know, if it's a small amount, it's going to be self-limited. More massive amounts, and it's hard to say exactly how much. There is, I didn't mention this in my talk, but several studies, there's 610 cases, 22% were asymptomatic, minor symptoms, another 64%, 5.5% were moderately severe, and 3.2% died. So, in generally, it's really the dose makes the poison. So it really makes a difference how much is ingested. And there have been, it's not a leading cause of suicide, but there's, it has been a cause of suicides in different countries, but it is not as lethal as others. So really, I don't know if that answers the question, but it all is the amount. Minor amounts are going to be more self-limited and irritant, and higher amounts can cause, cause death.
Okay, another question is if we need to wear protective gear to apply glyphosate, how safe is it to eat food sprayed with it?
It's an interesting question. I know there was another question in the Q&A about how long it takes for glyphosate to break down in the environment, and classic answer is it varies, but depending on the conditions in the environment, it can be anywhere from a few days to, in like colder, drier climates, it can certainly last longer because there aren't the microorganisms to break that down. So the seeing it show up in food is oftentimes from residue. There are limits that are set for when things can be applied and when things can be harvested. And I would say, if it's, really a concern for individuals, looking at those products where residue or levels are higher is a great way to think about it. The way that we have regulated our food is that, there are, they're looking for contaminants at all times and determining what is safe.
Also, one of the issues, there's restricted entry levels, and for the different pesticides, some that are more toxic, it's a longer period before you can enter without personal protective equipment. Others, it's a shorter period of time. So, and that has to do with the residue that's on the crops and when it's considered to be safe to enter. But that doesn't really answer the long term. That's more for the short term safety issues for those entry intervals.
So with that, I'm going to share my screen again and invite Sarah to.
Thank you, Lisa. As you can see on the screen, we've got the link for the evaluation, and I just put that in the chat as well. You will be asked which series of webinars this belongs in, and it's our family-friendly Earth Care series. So definitely work your way through that. Again, if you need a certificate of participation, complete the evaluation, and one of the final questions will prompt you for information needed for a certificate. We invite you to participate in our other webinars currently May through August. We have 9 series with 31 webinars. There is a URL and a QR code, and we will be sure to include these in the follow-up email that will be sent to all registrants. Thank you, everyone, for participating in today's webinar.